First, I'd like to welcome you all to our third webinar in this series. Today's webinar is entitled Social Care Technology Innovations for the Citizens of Britain, a Case Study, and will be delivered by Dr. Salah Al Majeed. Dr. Salah completed a PhD in Electronic Systems Engineering at the University of Essex in the UK. His academic appointments include acting head of School of Computer Science at the University of Lincoln in the UK and lead of STEM and Education IEEE activities for the UK and the Ireland section. In the area of research, Dr. Salah is interested in discovering the challenges in data exploration through wireless networks, 4G and 5G, and the Internet of Things for smart environment, focusing on healthcare applications across interdisciplinary systems. These research projects were supported and funded by the UK, the EU, and other international organizations and companies. He is a reviewer for many well-known journals, including IEEE Transactions. He has published in national and international conferences, as well as academic and professional journals. He is also the editor-in-chief of Computer Science Engineering, an international journal, and an editorial member of the International Journal of Computer Science, Engineering, and Application. Dr. Salah has been invited as a keynote speaker to many international conferences and events. His fellowship include recently the recognition as a senior member of the IEEE prestigious organization. Now, Salah and I go way back. Dr. Salah, the floor is entirely yours. Take it away.
Thank you so much, Professor Marcel. And I would like to thank you ever so much for having me here. It's really a pleasure, to be virtually in Lebanon and virtually engaging with you. And hopefully in coming future, we will be having a meeting and this kind of presentation in person where I can see you and really get engaged with every single aspect of the organization. Right, so let me hit the road, especially the first few slides is going to be nothing related to the research, but a little bit about the institution I am working in and where the university based. Let me tell you a little bit about Lincoln. This is where we are at the moment. Very nice city. This city, a very ancient city, 2,000 plus years of history. Been nominated one of the friendliest cities in England, in the UK and England. That's based on kind of measures in there. Of course, one of the top 5 happiest places. So this is an open invitation for you to have a little bit of leisure in here. The university itself, it's well ranked around the world. It is one of the top 150, and that's based on the higher education Young University ranked 2020. Modern University of the Year, that's for last year, as well as we are one of the top 20 for students' experience. Of course, we are very carefully looking at the university from perspective of worldwide, and we have a golden standard university for the TEFT Teaching Excellence Framework. That's for 2017. That's the latest kind of survey, and we are having a 5-star. I mean, by saying we, the university, having 5-star rating. Number of students about 17,000. With about 10% plus international students. The school itself, it's one of the biggest schools within the university. We do offer quite good range of programs, undergrad, 3, 4, the 4th is coming, or the new one's coming, robotic. But a quite good range of postgrad as well, robotic, autonomous, computer science, game development, intelligent vision, cloud computing, and the new ones that's coming. Of course, in addition to a research degree for PhD and master. A nice labs. This is the latest labs that we have. We have about 6-7 labs of these lovely ones, 24/7 open for our students, and we would love to have them more into hands-on. I thought it's a very nice picture. One of my colleagues who took a night time, and he said, like, look, this is a very nice living environment. I'm saying living because we love to see our students having more engagement within our environment. Within the school, we do have 4 different research group and centers. We have LCAS, one of the biggest research centers. It's interdisciplinary. All those focus on robotic, but different application of robotic. We do have a vision engineering, or a laboratory for vision engineering lab, as well as interactive technologies lab and machine learning group. Those all working together in different applications, mainly agriculture. And we also do a little bit of medical application in addition to energy, and try to satisfy the country needs all around. For us as a university, we have, especially the school itself, we've been considered as a world-leading research, especially for the REF assessment, where the REF means Research Excellence Framework, some kind of a survey and practice here in the UK to look at the research activities around every single university. So we are really proud of that kind of leading aspects. So that was a little bit about the city, university, and the school, and what we're doing in there. Let me take you through a journey of one of my interests in research around healthcare and how much technology around healthcare involve into that. So social healthcare, it's a really journey, and it's a daily use of technology and so on. And it's kind of long story. Let's start with what we are going to see later in about an hour. We will be talking about existing research and statistics, what research already exists and what findings direct this research project. This is a part, by the way, this is a part of ongoing research sponsored by, as you can see the logos here, sponsored by Serco, which is one of the biggest companies in the area of IT and computer science, and the County Council, Lincolnshire County Council, both together as a partnership with us to have this research ongoing. It's well sponsored, and they're going to be lead into opening and establishing research center around excellent research, innovation around healthcare and innovation. Right, so continue with the agenda for today. So we're going to have existing research and statistics. We're going to look at the trend in social and healthcare. What types of technology are there? We look at also the proposal for a social healthcare technology framework, which we are proud to put it in, and the importance of the innovation going forward. In addition to where are we now at the moment from that kind of perspective, and the future vision would be useful to share it with you later. So let's look at the existing research. What needs to what needs do patients have? That's a very, very big question, because there is no one size fit all, and this is a crucial kind of point of view, where to look and how to look at it. We found there were 3 main projects, ongoing projects within the UK. One of those called Whole System Demonstrator Project, and I will go with you through each one of those projects. The Orthopia project and electrification of social care. Those being integrated within the system within the UK. When I'm talking about within the UK, I'm looking at county councils, authorities, and how those guys integrate these projects within their daily life, and they provide such a service to their patients. So looking at the whole system demonstrator program started 2008, aimed to identify the effectiveness of telecare use. So the project was expected to conclude that telecare was effective in reality. But how? Well, aims to identify effectiveness of telecare, expected to conclude that telecare was effective. Really a lot of challenge around that. Associate researchers found no evidence that telecare really resulted in policies among a group of stakeholders, government, especially policies provider, policies supported development of telecare at a certain level. Local authorities, they got a lot of challenge around that. So there are things need to be careful around in this. One of it was the budget allocated to this project, not that equivalent to the service being provided. That's one. The manufacturers of telecare conclusions, it costed like over than it should be. The carers, some already using telecare that had now been demos for solutions. Now, supporters are having a lack of technology to understand how that can be done. So different authorities, different governors around the UK found out much difficulties in to go ahead with this kind of project. Moving with that, the 2018 a kind of upgraded projects came into the market, aimed to identify the accuracy of the whole system demonstrators or WSP. More online surveys, interviews carried between November 16 and January 17, aimed to identify the relevancy of those projects and what's conclusion in there. So a lot of work being done, to be honest. Yet, about 25 authorities, local authorities, from social care perspective, they got representative in a sample, semi-structured interviews, and so on. So the project identifies some key points highly relevant to the goal of our project itself. So what are these? What I said, an overall low level of prior knowledge skill, and I'm gonna keep that in mind because this is a very crucial point. I would like to come back to it sometime later. Right, we should supplement, not substitute. Now, when we talk to people about technology and we would like to provide them more smart home, provide them more kind of application, there is a big fear that we are replacing the human touch, replacing the human care. And that is not the case. So we are thinking toward supplement, not substitute. Then the other point is the flexibility and adaptability, which is very much a key. Let me go back a little bit to the supplement one. And for the supplement one, concerns from stakeholders and carers about hands-on care being reduced by technology are still relevant. There's still fairness around that. So the proposed technology should supplement existing care, not aim to replace it. So that I would like you to keep it in mind, and which is challenging, really, thoughts. Also, we look at the flexibility or inflexibility of available service bundle. Now, in here in the UK, there are service bundles provided by different authorities, by different local authorities, I would say, to different patients. So we have what we call it independent or dependent patients. So there are those independent ones who are living in their own homes, but they are having a care service from the council, or they are dependent on the council in terms of their residency as well. So there are different ones. There are flexibility, and I keep back to the one sentence saying there is no one solution would fit all, especially from the technology perspective. So low maintenance, supplementing in nature, and highly robust. That's what that project came with. Alexification, it's a new era of using of social care, a kind of a technology integrated into service. Majority reported active use of Alexa devices, and that's lovely. Really, all of us would like it. So Alexification of social care, that kind of project interviewed representative of 8 local authorities across England, selecting those staff who were involved in the use of technology in adult social care. The interviewees were from broad range of roles, from director adult social care, social service, general commissioning managers, and so on. Majority of those local authorities, 7 of 8, reported active use of Alexa devices, but 1 reported using them as a part of standard telecare package, with the rest still trailing Alexa on going base. One of the interviewees stated that they had experienced situation where people had obtained Alexa or Echo devices, not understood why the devices wouldn't respond to their request as such as Alexa, turn the lights on straight out of the box. So that's a gap of technology between what is happening on the floor, understanding the technology and how the technology fits the needs. That's something also we would like to look at it. We don't want to go and make life complicated. Alexa is very nice when it's integrated, but not when you take it out of the box straightforward or straight away. So this is just that simplicity and ease of use should be key focus points for any devices, services we create, and where possible, devices service would be just work, right? Pursue a sense of normalcy. That's another thing I want you to think about technology, how to use it with providing a service care, especially in a care. Of course, very carefully looking at the privacy and consideration of implements. In that case, let me go a little bit and talk about that, how many of those representatives from different local authorities really show their awareness and share their concern about the privacy by using Alexa. One of them said, well, Alexa always listening to me, and I don't want to that. This is kind of a spy. Others have really been with a different, especially for those with mentally disabled. They had a problem with Alexa because they didn't expect a device, something there, talk to them and react into that. The reaction on that wasn't good. So it's a mixture kind of feeling from the floor on how we are going to use the technology. Back again to use the one sentence I mentioned earlier, is that no one size fit all. Keep that in mind, and we'll move into where with that. There are other few newest, I would say, technology or research being there where technology integrated into that. So the 2 key papers and 2 key projects around the area here being done: intelligent monitoring for elder care using vision-based technology, and systematic review of robotic research in home care. Here in-house, we have had a project, European project, where we propose having a robotic to help in reminding and helping, assisting, put it in this way, the carer, the patients in their private homes. That was good one. However, identify the shortcoming with the similar technologies, that robustness, testing, latency, and privacy were a huge concern around that area. Right, so what needs do patients have? If I summarize that one, easy to use and maintenance, supplement, don't replace, versatility and adaptability, prioritize capabilities. So those 3-4 points need to keep in mind whenever we look at a patient. We talk about elderlies, we look at a gap of technology understanding and a use of that. And you may say, well, there are hundreds of different type of technology could fit. Yes, you're right, can fit. Not all can talk to each other. Not all can be there. So where are we going with that? So what are the limitations of the technology currently in use? So look at that. We look at lack of robustness, sensitive to environment, and patient variability. Those are really crucial. If you look at it, different patients, you're talking about patients with dementia, how many times are you going to teach them how to use their mobile? Yet they will forget that. How are we going to do it? And so this is a challenge in there. Sensitivity in terms of voice, in terms of different mentality, different mental health, and different patients, different needs, put it in this way. Okay. And of course, security, it's another, especially if you look at it, security slash privacy. Those are very, very crucial and important as well. Right, with that, there are other few limitations. Okay, intolerant patients' attributes should be taken into account wherever feasible and beneficial, and non-interoperable devices can communicate which within a network are more precise. So these two things I feel very crucial. So what's the solution in general? We feel that the solution is a system-based, but definitely taking in consideration the interoperabilities system-based. Right. A little bit moving forward, to look at it carefully, what type of technology exists. So we've been earlier talking at the different side of the bridge, where more patients needs more variety of needs in a different type of patients, I would say, different type of disabilities, needs, and so on, and challenge around that. But then definitely when we look at the shelves, on the shelves, there are different type of technology. Major categories, if we're gonna go and categorize these, we're gonna look at assistive technology, and this is bespoke, specialized devices tolerated for specific needs and often privately manufactured. However, when you look at the everyday technology, I'm sure everyone is going to look at their mobiles, they look at their watch at the moment, smartwatch, and they're going to say, well, look, I have everyday technology and it's work fine. Yes, it is. It's everyday technology, typically low cost, off the shelf, consumer grade technology modified to perform care-oriented functions, right? So you got 2 points here: tolerated and bespoke, and general and modifiable. So those 2 points really pushed us to think in the right direction. Right, so let me go dig down into assistive technology. So assistive technology, look at it, where physical assistive technology, visual assistive technology, hearing, speaking assistive technology, and wearable devices or visual wearable assistive technology. The physical one, we look at mobility aids, head pointers, mouth sticks, spin, sip and puff systems and strap. Visual one, you look at speech recognition, synthesis, magnification system, and so on. Hearing, that's automatic transcriptions and eye gaze tracking and so on. And wearable one, of course, full detections, health fitness monitoring, reminders, and so on. So nice kind of classification in here. However, go broader with that, we're going to look at the Internet of Things. Everyday technology is really based on that. But Internet of Things is just an interface between different devices to talk to each other. Behind that, you could look at those devices communicating between each other to use edge/fog and the cloud computing. Of course, big data is there. And then what you need machine learning and intelligent vision to support your backbone and to understand what kind of data and how we're going to make a right decision at the right time. So it's a full picture in here, as you can see, different technologies. But still there is a gap, and I will share that with you. And to that, I can see, well, this is not us. This is just an image shows a cross-sectional cutaway of example home with indicated, for example, devices that could be used in at-home care that could potentially be utilized as a data source via the proposed. We're going to have a look at our proposal, which is going to be microservice-based system, which will be covered later in a few seconds. Many examples are given here. As you can see, you look at smoke detector, IP cameras, heating, and definitely you will say, well, look, most of these exist today. Absolutely, you're right. But if you have a Samsung TV and Apple mobile, they are not talking to each other. If your kettle has a sensor, that definitely not talk to your smartwatch. And if you have a camera, you have to have the right application into your mobile. And so the problem, they're not talking to each other. And this is what we are really having a problem with. So we found out a few gaps around what's available on shelves. One of the things I always would like to use, do not invent the wheel, make a better use of it. And this is what we are trying to do. So what we have, what gap has been identified via prior research, 5 primary features that constitute of the gap between patient needs, desire, and available technology. So now we're going to have a bridge between those, the need of patients and availability of this technology. A lack of environmental robustness, as we mentioned earlier, high variable home environments are hard to prepare system devices for. Inabilities to handle patients' variants, unexpected variations, such as less common skin or color, can result in misclassification, unexpected latencies, that queries should be responded to in a timely manner. Those unfamiliar with technology can assume that a device has broken if a response is not given or not given quickly. So there's kind of assumptions there through the interviews and definitely through the surveys well, I'm talking to that device, but there's got no response. So it's not working. I don't believe this technology, the trust, broken trust in between the technology and the patient, or in fact, the patient and the technology. And finally, system devices were not properly tested in real time or in real life or well simulated environments. So which is a key, really a key aspect, as this would aid in accounting for environmental and patient's variation at least. Right. So nearly the end, we'll see that the proposed framework, looking at it carefully, what we're going to propose in here, what we need security, interoperabilities, microservice. Okay, so how does it look like that? We need backbone, and that could be cloud, could be edge. We need also an integration, user interface. We need a complicated kind of environment, but complicated not to the user. We need to simplify that in a way that user can have it. Now, we talk about different type of users, remember. We talk about patients with different challenge and disabilities, and different type of those who might has a need to different type of interfaces, simplified ones. And also the carer. Honestly, even the carer, they have a problem with the technology. Even the technologist has a problem with the technology, different use, different tactic. And I'm not quite sure how many of you, if you are wearing smart watch or you are using mobile, have you discovered every single function in your device? So it is challenging, it is, and especially with those in needs. So we would like to come up into a right system that really tick all of those points, all of these points. So the area of improvement can be summarized in 3 points. So look at security aspect. There are not much, non-existent or minimum of encryption and decryption are available to help into that. Well, there are a lot of things, but definitely we have a big challenge around cybersecurity practice. We look at also the interoperability in terms of a communication between devices within IoT environment, and how that can be there, and the integration, system integration between those. So we come up with a very nice framework, a little bit complicated. So what we thought to go around a different area and try to put a different practice, and then that's all gonna be a hub. So imagine the flow chart in front of you can be translated into a software and integrated into a hub. This hub can make life easy. Just gonna move with that. Gonna be life easy to elderlies, to patients, to improve their living days. Now, do we need that? How much we need out of it? I think we need it all. The reason, at the moment, as I said earlier, there is no devices talk to each other. So we would like to make sure those very nicely talking to each other with a very reliability, with a latency, acceptable latency, and simplicity. Considering that, that hopefully will address some of those coming issues. Population aging issues. Here in the UK, we're expecting to have it double. So the people age 60 or over is set to double by 2050, which means accounting for 1 in 5 people, making population aging one of the most difficult challenge. Now, in the UK, we do deliver caring for elderlies, and some of those private, some of those government sponsored, but yet they need to be need to have some caring in there. Who will do that if 1 in 5 of people are making publishing that much? Also, despite this, adoption of technology continue to climb of this those age 55 and over, with 90% respondents to a survey by 19 that they have Wi-Fi in their own home, and 80% reporting that they personally own a smartphone. But despite their popularity for larger technological advancement, are adapted comparatively slowly for use within home care. Different, as I said, I don't want to go back to the slide number 1, the different issues around that, definitely. Again, we'd like to see, and with our proposal, we would like to see a technological adoptions rate. Means that hub, that kind of algorithm will communicate between different devices smoothly, nicely, getting the kettle with the camera, with your mobile, with your TV, all talk to each other, whether they have different protocols or whether they have a different structure in terms of manufacturers or so on. And wherever we're going with the development of new technology, that will be going nicely to be integrated within their care homes. So what's next? So what we are going to have, we try to look at the Alexification, the smart home technology, and Alexa or Alexification, it's still something we could do, obviously, and we continue with that, but that's not going to fit everyone. Again, no one size fit all. Still severely lacking interconnectivity, and we hope that by this algorithm to have the interconnectivity better than whatever exists at the moment. There are, of course, still disappointment around non-robustness, and that's something we are going or trying to address it. So going forward, from a system approach perspective, we think the interoperability is the way forward. By this, I think I have finished my presentation, which I hope something useful and make you think. Of course, I would like to put some credit to the project team in here, James and Mubin, and of this, as I mentioned earlier, this is part of a project, ongoing project, and the partners, Serco and Lincolnshire County Council, are one of those who are providing the support. So thank you so much for that.
Thank you very much. Thank you very much, Dr. Salah, for this eye-opening presentation about health informatics, healthcare, and the interoperability between different systems to provide the best healthcare possible for, as you rightfully put it, aging population. We do have that particular problem here in Lebanon. Unfortunately, here we're not as advanced. Having said that, I will now open the floor to our attendees to ask questions, but maybe I will be a bit more progressive here and kick off the question session. I don't want to take too much time by a question related to that interoperability. The different devices that will need to speak to one another, and these different devices, of course, they have different hardwares and APIs. What sorts of solution are you looking at to make some sort of a common language amongst those different devices. So that's, I mean, I don't want to talk about the patient themselves. And I know this is a whole different can of worms that, you know, it's very difficult to address, but just the interoperability between those different devices.
Right, thank you so much. And it is challenging, you're right. It's very challenging. And this is where is the problem is, I think. So looking at it from network perspective, looking at it from IoT perspective, it's not only the one solution. And yes, those sensors, actuators, cameras all need to talk to each other. You're right, but those are different manufacturers. So looking at, if I go networks a little bit and go dig down, the network the structure has the OI system, OSI layers. So those starting with the physical layer, MAC layer, and so on. When we look at those two layers, MAC layer and physical layer, then here is a bit of technology or of technique solution in there. So what we thought, if we look at the IP from each device and try to take it over, and here we put AI integrated into this, and then we look at the data and so on. So it's a mixture, blended ones between different aspects. So we're looking at the data that's coming and going through a network and monitoring the network through the physical layer and MAC layer. Look at that and try to analyze it by using machine learning and AI, and to make sure those will talk to each other nicely, smoothly. Robustness is important. Latency is other things in there.